You say that your father was a real motivating factor as well in your journey. Tell us about that.
Unfortunately, during COVID, my father passed away.
Sorry to hear that.
So it was a really hard time for me. I was in a deep, dark place. There was a void in my heart that I had never had. And my friend, Brett, who was a personal trainer, he said, you know what? We're going to focus on your physical strength. And it really helped me bring solace to my life and help me become emotionally stronger. There were some days when I didn't want to exercise because when you're depressed, you don't have motivation to do anything. And I remember some mornings I would wake up with the picture of my dad poking me. He used to call me baby, and he would poke me and he would say, "Come on, baby, you can do this. You can do this." And it helped me have the motivation to get up and exercise. And I remember my dad always telling me, sometimes when you can't do something for yourself, do it for others. And so really he helped me to get out of bed and exercise and just get healthier. And so he's still with me.
Well, I can see that. I was just going to say that he's
Mhm.
passed on, but he's watching you. He's proud of you, and he still plays a big part in your life. And Dr. Silva, why are balanced hormones also so crucial for looking and feeling good as we get older?
Well, as I'll use myself as an example, I had my fourth baby when I was 40 years old. And anytime you have a pregnancy, your body's going to change. And I started to have mood changes, hair loss. I started to get fat around the middle. And then when I was 47, something happened. I had a teenage son at the time that was going through hormonal changes. So we were both going through hormonal changes. And he said to me, "Who are you? And what did you do with my mom?" And I realized when I become unrecognizable to the people that I love, I needed to get help. So I went to my doctor and they wanted to give me antidepressants and birth control. And I knew that wasn't going to be the answer. So I looked outside of mainstream medicine and I found out about the bioidentical hormones, which are plant-based hormones made from the Mexican yam to, to help me replace the hormones that I lost. And I actually did a fellowship to learn more about the bioidentical hormones so I could help other women like myself.
In your practice, helping other women, how do you determine the optimal amount of hormones people need? Because you don't want to shut down their own production of hormones. Hormones are an important thing, but they have to be in the right amount.
Well, you want to check levels, right? So I am a scientist, I'm a medical doctor. So I'm going to check their blood levels. You can also check urine and saliva levels for the hormones. But I like checking their levels because you want to be physiologically monitoring their levels of hormones. And then I come up with a customized plan based on their lifestyle, based on their goals. What are they wanting in their life? Because we focus on quality of life issues, but we want to follow the hormones so we can do it safely.
Gotcha. And you say the balancing hormones can help with a host of age-related ailments as well. Can you explain that?
Well, I used to think that going through perimenopause or menopause was like a rite of passage, right? As women, we suffer, right? Every month we have our period, we go through labor. And so I didn't know that that's what we had to do until I went through it myself. And when I realized that quality of life issues could be better, that's when I decided I needed to do the hormones, but not only sleep, energy, mood, sex, stamina, hair, and skin are better, but also ailments like dementia and osteoporosis. If you go into a nursing home, you're going to see that more women than men have hip fractures, and the testosterone will help with bone strength, and mobility is independence. So for me, it's important that women have adequate testosterone levels, and most doctors don't even check testosterone for women.